1 in every 8 deaths that happened around the world, it was because of exposure to air pollution.
Air pollution is the number one killer of premature mortality in South Asia.
Today there is clear evidence that almost every organ in our body is getting affected by air pollution.
But the most important thing I think is it kills us.
Air pollution was with us forever. What is relatively new is the knowledge about it.
Air pollution is killing a lot of people around the world, especially in South Asia region and in Nepal. The number is very big, and the most important thing is to protect the human health from the harmful impact of air pollution.
We talk about other diseases, right, COVID outbreak, but when you look at the statistics, number of people killed or dying from air pollution exposure is much more higher than the number of people died as a result of you being infected with COVID virus.
When people think about air pollution in a general way, they would tell you, yeah, difficulty breathing, some chest problems, but in fact what we know from decades of research now is that air pollution not just impacts our lungs and our respiratory health, but also our heart, our cardiovascular health. It can have impacts on our brain, both in children and in older adults. It can result in people dying early, but importantly, it also means that many people live for many years with diseases that cannot always be cured, like COPD, which is a chronic respiratory disease, makes it harder to breathe for people. And especially in South Asia, we see over 50-60% of all COPD deaths happening because of air pollution. But that reduction in life expectancy essentially means that if a child is born today, they will live 2 to 5 years less than what we expect them to in the absence of air pollution. So that's a pretty significant loss.
Air pollution can increase the risks of high lipid profile, which is a major risk factor again for multiple diseases, linkage with glucose level in the blood, mental health.
With the assumption that, high pollution levels are affecting health, we started to learn that even lower pollution levels, those which we experience every day and most population experience every day, are also affecting health. So when we started to estimate how many health effects are associated with air pollution, then I think the message was coming up to the society and politicians later, that it is really a massive problem and serious global problem. People are exposed to air pollution from day one of life or even in pregnancy. The exposure continues throughout the life. It's affecting health, it's deteriorating health, and at the end it leads to earlier death. It's really very difficult to avoid air pollution unless you make very brave decision to move to the region where air pollution is significantly lower. And actually it's not up to the individual to a large extent to manage this. I mean, there is some impact of individual lifestyle, individual choices, but it is limited. So it is, let's call it society or external factors